Hello and welcome to the channel. Today let's learn about the H3N1 virus. According to the World Health Organization, seasonal influenza is an acute respiratory infection caused by influenza viruses that circulate in all parts of the world. There are 4 types of seasonal influenza viruses: influenza A, B, C, and D. Influenza type A viruses are classified into subtypes according to the combinations of different virus surface proteins hemagglutinin, HA, and neuraminidase, NA. So far, there are 18 different hemagglutinin subtypes and 11 different neuraminidase subtypes. Depending on the origin, host, influenza A viruses can be classified as avian influenza, swine influenza, or other types of animal influenza viruses. Examples include avian influenza bird flu virus subtypes A, H5N1, and A, H9N2, or swine influenza swine flu virus subtypes A, H1N1, and A, H3N2. Transmission: seasonal influenza spreads easily, with rapid transmission in crowded areas including schools and nursing homes. When an infected person coughs or sneezes, droplets containing viruses are dispersed into the air and can spread up to 1 meter. The virus can also be spread by hands contaminated with influenza viruses. The time from infection to illness, known as the incubation period, is about 2 days, but ranges from 1 to 4 days. Signs and symptoms: sudden onset of fever, cough, usually dry, headache, muscle and joint pain, severe malaise, feeling unwell, sore throat, and a runny nose. Cough can be severe and can last 2 or more weeks. Most people recover from fever and other symptoms within a week without requiring medical attention. But influenza can cause severe illness or death, especially in people at high risk. Industrialized countries, most deaths associated with influenza occur among people aged 65 or older. Clinics and hospitals can be overwhelmed during peak illness periods. Research estimates that 99% of deaths in children under 5 years of age with influenza-related lower respiratory tract infections are found in developing countries. Prevention: the most effective way to prevent the disease is vaccination. Injected inactivated influenza vaccines are most commonly used throughout the world. Who recommends annual vaccination for? Pregnant women at any stage of pregnancy. Children aged between 6 months to 5 years. Elderly individuals aged more than 65 years. Individuals with chronic medical conditions. Healthcare workers. Apart from vaccination and antiviral treatment, the public health management includes personal protective measures like regular hand washing with proper drying of the hands, good respiratory hygiene, covering mouth and nose when coughing or sneezing, using tissues and disposing of them correctly, early self-isolation of those feeling unwell, feverish, and having other symptoms of influenza, avoiding close contact with sick people, avoiding touching one's eyes, nose, or mouth.